So let's talk about something that's often lived in silence: chronic pelvic pain. A recent study in the French Journal of Urology is taking a hard look at a new kind of therapy that could really shake things up. We're going to break down exactly what they discovered, and it all starts with one single number.
Okay, I want you to lock this number in your brain. 52%. Right now, it's just a number on a screen, but trust me, by the end of this, you'll see why it's the most important part of this whole story.
So, to really get why that 52% matters, we first have to talk about the sheer scale of the problem here. This kind of chronic pain, it's way more common than you might think.
It's pretty staggering when you look at the numbers. We're talking about somewhere between 5 and 15% of all women experiencing this. To put that into perspective, that could be millions and millions of people dealing with a condition that is just incredibly tough to talk about, even with a doctor.
And look, this is not some minor inconvenience. We're talking about something that can completely disrupt a person's life. It can strain relationships, wreck your sleep, and cause real psychological distress. And the really frustrating part, a lot of the time, there's no single obvious cause, which makes finding a treatment that works a total nightmare. And it's exactly that frustration, right? The difficulty in finding a cause, let alone a treatment, that's pushing researchers to think way outside the box. The study we're digging in today is all about one of these new ideas: light therapy.
It has a pretty technical name, photobiomodulation, or PBM. But the basic idea is actually pretty cool. It's a therapy that doesn't involve surgery or drugs. Instead, it uses a very specific kind of low-intensity light. You can think of it like this. It's not about heat. It's about using light to gently nudge your body's tissues to calm down, dial back inflammation, and start repairing themselves.
So you're probably wondering, what does this actually look like for a patient? Well, it's designed to be really straightforward and patient-controlled. The patient self-inserts a sterile probe, a preset treatment runs for just 5 minutes, and then they remove it. That's it. This is usually done once a week for about 6 to 8 weeks. Okay, so we have this new therapy. The next logical step, and what a team in France decided to do, was to put it to the test. They wanted to know two really important things. First, does this stuff actually work? And second, is there any way to know who is going to work for? So they did what's called a retrospective study. They looked back at the data from 136 patients. Now, not everyone completed the full treatment or all the follow-ups, so for their final analysis, they narrowed their focus down to a core group of 52 women who saw it all the way through. But that brings up a really important question, doesn't it? How in the world do you measure if a treatment for something as personal as pain is a success? It's not so black and white. Well, this is where the study gets really interesting. The researchers decided that success wasn't going to be defined by a doctor's chart or a lab test. No, it was all about the patient's own words. They used a standard tool where patients rate their own improvement. A success only happened if a patient said they felt very much improved or much improved. It's all based on their real-world experience. All right, so we've got the therapy, we know how they studied it, and we know what they considered a win. So what happened? Well, the results are a bit of a mixed bag, and honestly, that's what makes them so fascinating. And boom, there it is. Remember that number from the very beginning? 52%. That was the overall success rate. So just over half of the patients who went through the therapy reported that they felt significantly better. The study calls this a moderate success. But the story doesn't end there. As the researchers started to sift through the data, they started noticing some interesting patterns. At first glance, it looked like you had a better shot at success if you were non-menopausal, didn't have vaginal atrophy, and if the pain you felt wasn't mainly a burning type of pain. Okay, so that seems pretty straightforward, right? Case closed, we know who this works for. Well, in medical research, it's almost never that simple. And this is the real kicker. When they ran a more powerful analysis, one that looked at all those factors at the same time, poof, those promising clues just disappeared. Not a single one of those things, not menopause, not atrophy, not even the type of pain, was a reliable predictor of who would get better. This is such a great way to see what happened. It's a total reality check. You had these factors that, on their own, looked really promising. But when you put them all into the mix in the final, more rigorous analysis, none of them were strong enough to reliably point to a successful outcome. Okay, so after all that digging and analysis, what are we left with? What's the bottom line for doctors and, more importantly, for patients? The best way to sum it up is to use the researchers' own words. They basically said, look, we saw a moderate success rate, but our deep dive into the data couldn't find any single thing that predicted who would get better. So let's pull this out of the scientific journal and into the real world. What does this actually mean for someone dealing with this pain every single day? All right, here's the rundown. On the one hand, you have a non-invasive therapy with a good safety record that helps about half the people who try it. That's a huge plus. But the flip side is, it's definitely not a silver bullet. And the biggest problem is that there's just no way to know beforehand if you're going to be in the lucky 52% or the other 48%. And we have to be really upfront about the study's own limitations, which, to their credit, the researchers point out themselves. We're talking about a small group, only 52 people. It was retrospective, meaning they were looking at past data. And most importantly, there's no control group, no placebo. So we need more research to be sure. And so we land right back at the big question, don't we? Is this a genuinely promising new path for pain relief? Or is it more of a treatment that's still searching for the right patient? For now, the answer seems to be, it's a little bit of both.